Hi, so yeah, thank you. So I'll be talking a little bit about the research study that we've been carrying out over the past few years into a number of different brachycephalic dog breeds. So where we've used the respiratory function grading assessment to investigate how these breeds are affected by BOAS or brachycephalic obstructive airway syndrome. So to start with, just a quick update, recap on BOAS to begin with. So it's a condition of varying severity that's associated with the brachycephalic skull type, namely flat-faced dogs. So the most typical sign of BOAS is noisy breathing, which is due to obstructions in the upper airway. This impacts a dog's ability to breathe effectively, meaning they can find exercise difficult, struggle in hot weather, and have sleep apnea. So treatment can include weight loss and lifestyle changes, although surgery is often required for the more severe cases. And in a lot of cases, it can help with the clinical signs, although it might not be curative. The respiratory function grading assessment has been developed as a standardized way to assess whether a dog is affected by BOAS and also how severe that is. Plasmography was previously used to look at the measurable differences in the breathing characteristics of these dogs. And the RFD assessment was originally developed as an accessible tool for the three popular breeds, so the pugs, French bulldogs, and bulldogs, to identify which dogs need clinical intervention and for monitoring surgical outcomes. So the RFD assessment involves listening to their breathing before and after a 3-minute exercise test, and the dogs are scored from grade 0 to grade 3 based on their breathing sounds, respiratory effort, and exercise tolerance, with grade 2 and grade 3 considered to be clinically significant, so more likely to need treatment or intervention. The RFG was launched as an official health scheme with the UK Kennel Club in 2019 for the three breeds, the French Bulldogs, Bulldogs, and Pugs. So these are the most popular flat-faced breeds who are more typically predisposed to BOAS and make up the majority of the clinical caseload for BOAS within veterinary clinics. But that sort of brings us on to our current research that we did. So whilst we know more about BOAS in those three breeds, we wanted to look at other brachycephalic breeds and see how BOAS affects them. In our study, we included 14 brachycephalic breeds of all different sizes and types. So large breed dogs like the Boxer and Dog de Bordeaux, bulldog type breeds like the Boston Terrier and Staffordshire Bull Terrier, and several toy breeds like the Chihuahua and Pomeranian, and other more flat-faced breeds like the Japanese Chin and Pekingese. So our main research question was that we wanted to discover whether other brachycephalic breeds do suffer from BOAS, how commonly they do so, and to what degree, so whether you're talking about mild BOAS or severe disease. And then also, given the different shapes and sizes of the brachycephalic breeds, we wanted to look at which conformational traits were more associated with BOAS. In terms of how we went about the data collection, we recruited dogs from breeders at breed club shows and pet dogs as well. Most of the dogs we assessed were Kennel Club registered. Overall, we had almost 900 dogs take part, and all dogs underwent a general clinical examination where we looked at other aspects of brachycephalic health, and of course the RSG assessment as well. And then we also collected a number of conformational measurements, such as craniofacial ratio, neck girth ratio, body height and length, and tail length as well. And then we looked at some of these factors both across breeds and within each individual breed. So coming on to the results of our study, overall there were clear differences between the breeds. As a benchmark for the comparison of BOAS risk, we used the proportions that were documented in a similar study by the research group in 2016, which found that within the groups of pugs, French bulldogs, and bulldogs tested, approximately between 10 to 15% were grade 0. As we know that these three popular breeds are more predisposed to BOAS, we term this higher risk. And there were only two breeds which had similar levels of BOAS to these three breeds, which were the Pekingese and Japanese Chin. All of the other 12 breeds had significantly less dogs affected by BOAS, And we term those between 25 to 50% of dogs with grade 0 as moderate risk, which included the Griffon, Boston Terrier, King Charles Spaniel, Dr. Bordeaux, and Shih Tzu. And then those with over 50% of dogs being grade 0 as mild risk BOAS. So that's the Staffordshire Bull Terrier, the Cavalier, King Charles, Chihuahua, Boxer, Affenpinscher, and Pomeranian. The only dog not listed here is the Maltese, as almost all dogs were grade 0 bar 1. So we would regard that as a very low risk of BOAS within that UK population. And then coming on to the conformational factors across the whole study population, we found that three seem to be the most important in contributing to the risk of BOAS, which were the craniofacial ratio, body condition score, and narrowed nostrils. And this accounted for sort of 20% of the meaningful differences between affected and unaffected dogs. So it does sort of demonstrate how much of a multifactorial disease BOAS is. And then just touching on some of the differences between the breeds, which came out quite differently for each of them. So narrowed nostrils were a big risk factor in many breeds, but some breeds such as the Chihuahua and Staffordshire Bull Terrier, we found that the vast majority of dogs actually had quite open nostrils. So that indicates there might likely be other issues that are causing airway obstruction in these breeds. In the Staffordshire Bull Terrier, the Boston Terrier, and the Dr. Bordeaux, having a proportionally thicker neck was more important, and these breeds do tend to be more well-muscled. In some breeds, some factors didn't come out as significant, and this was likely due to there being a limited amount of variation within the breed, or that the variation was more than the measurement error. For example, in the more flat-faced breeds like the Griffon, the Charlie, Japanese Shin Pekingese, craniofacial ratio wasn't a significant factor. And then overall, within the BOAS grade prevalence results, this shows how each breed is in a different situation with regards to BOAS. So we hope that these results can help each breed find their own way in reducing the risk for their dogs. And then we also have created some infographics to help visualize this. I don't have time to go through all of the breeds individually today, but if you were interested in the individual results of any particular breed, they are available on our website and also our social media. And then following on from the publication of our research, where we found that we can implement this testing in more breeds, this has meant that the Kennel Club has now been able to expand the official RFD scheme to include these additional breeds. This was launched recently at Crufts, where free RFD assessments were offered. This had a really good response rate with an uptake of almost 300 dogs over the course of the 3 days. And in many of these breeds, there does seem to be a large pool of grade 0 dogs, which hopefully will make it easier to breed away from the affected dogs where BOAS is more prevalent. It could be more difficult, particularly in the smaller breeds that are relatively rare. So outcrossing could potentially need to be considered. But we were finding that doing this research was really helping to raise awareness of the signs of BOAS within the other breeds. So the Staffordshire Bull Terriers weren't originally on our list of dogs to study, but actually approached us as they found that some dogs were coming through that were affected. The vast majority of dogs were unaffected, but it was really encouraging to see that some breeds do want to take a proactive approach. And here's an example of an affected Staffordshire Bull Terrier. You're able to hear this. So whilst they are sort of rare within the breed, they do exist. And that's all from me. So thank you for listening. I'm happy to answer any questions, or if Jane is around as well. Thank you.